Welcome to Ageless by Rescu. This podcast is devoted to exploring the science of rejuvenation, uncovering the most trusted experts, the must-have products, innovations, and technology in the field of vitality, aesthetics, new beauty, and cosmetic enhancement. Well, you know what? One of my most popular episodes was the one where I talked about all the things that I've had done, and all the things that I've had done by you. So it seemed very fitting to come back at the beginning of this year and talk about the trends that we're going to see in aesthetics, in skin, in beauty. And there is no better person in my mind in Australia who's ahead of the game than you, Dr. Joseph Hkeik, my beloved skin expert and doctor. And I think one of the things that I love and admire most about you is you not only have a thriving, multiple practices in Australia, but you travel a lot.
That's right. Well, thank you, Baha. It's an honor to be here with you today. I can never get enough of you, really. And it's always joy to talk to you about anything, really, but especially about beauty and aesthetics.
Last year into 2022, you traveled a lot for conferences. You spoke at a number of events. And I'm curious to see, in a post kind of pandemic world, have people's attitudes and have the trends that, the manufacturers of the fillers, the devices that, we're all hearing about, has there been a big shift that you've noticed? Because you've been in this industry for over 30 years, but has there, it seems to me as someone who's covering it, that there's a pivot. And I'm curious from your perspective, are doctors around the world treating aesthetics differently?
Look, definitely. I think from the client's perspective, definitely there is a shift. People want to spend more time and energy on themselves, especially after the pandemic. I think we are seeing that shift, and people really care about themselves. No longer obsessed with working hard, playing hard, and not taking care of themselves. So I think we see that everywhere, including in Europe, in the States, in Australia. Every client that is coming forward, they really want to look after themselves to the best possible way. As far as the companies are concerned, yes, they actually get in a huge demand from people like us, asking for more product and better technology, better development. And the demand by the clients is draining the supply, if you like. So we're having shortage of product. Which is really interesting, because you think that you'll always have enough for everyone. But it hasn't been the case this year. We've had a couple of times where we completely ran out of product in the whole country, not just in our practice. In the whole country, we ran out of product. It's a sign that people are really enjoying this process of looking after themselves.
And I would say that, one of the things, the big trends is that men are now investing in aesthetic treatment. And that was, something that your practice was kind of an early adopter for. You were known as a clinic that would treat men. You were doing a lot of natural rejuvenation for your male clients. But now, I think the percentages is something like a 20-80% split, which is, it might not sound like a lot, but it is a massive lift in the number of men that are coming for aesthetic tweakments.
Definitely, and that's a worldwide phenomenon as well. We're seeing more men coming forward, and purely because they've seen their partners looking better and better with the years, and they're looking younger. In some instances, I've had people say, my girlfriend looks like my daughter, or my wife looks like my daughter, and therefore I need to actually follow her footsteps and look after myself. Otherwise, she might ditch me for someone much younger. But look, this is true. I think men have really adopted this change, and they're no longer taboo about men getting cosmetic work. In fact, when they come, they want to get everything done at the same time, because men are often not very good at organizing these time for self-care. So they just want to come every 3 months and get everything that they need to do in one visit, which is sometimes not possible, as you understand. But we certainly, in All Saints Clinic, we've seen at times 40% of our split is for male versus 60 for female, which
Wow.
is quite high. But I guess it really goes back to support this concept that men, more than women, but women equally, are searching for natural rejuvenating results and not to look like they've had anything done. And All Saints, we can do it really well.
One of the things I remember one time, and I think I've told this story before, is maybe this was like 15 years ago. I got off the plane in Dallas, and I remember being in Dallas, in Texas, in the USA, and being shocked by how similar everyone looked. And it looked like everyone had gone to the same aesthetic doctor or plastic surgeon, and everyone had almost an identical placement of filler, big lips, big boobs, teased blonde hair. And there seemed to be like a template for beauty. And even, 5 years ago with the Kardashianization of beauty, there was a lot of sameness, in the way people
Mm.
would style their brows, or the way that they would have Botox or filler, or any other kind of treatment. But again, there seems to be, a democratization and a more
True.
individual, well, not democratization, more an individualization
Yes.
of how people look, and a massive demand for a more natural look, certainly in
Yes.
Australia.
But look, Bahar, as you understand also, in our industry, there's probably about 10% of the doctors and nurses that work in our industry are artistically inclined, and there's about 90% are scientifically inclined. So the artists amongst us can see what natural beauty look like, and they can create that natural beauty. The 90% of the scientists, they can do procedures, and they learn by treating cheeks, or by treating lips, or by treating chin, and when they apply in these products, they think in that fashion as well. And then hence why you've noticed in the States, perhaps, that everyone had the same cheeks, everyone had the same lips, and then it start to look identical. And it's purely because they apply a procedure that they've learned somewhere to every face that they see. Where I'd like to see the change, and I think where we're heading in the future towards the future and 23 and then beyond, is a lot of these injectors have learned that they cannot operate as scientists. They need to operate as artists. So they're all trying to learn the art of full face rejuvenation every single time. And this is something we've been supporting and endorsing since day one at All Saints, is that we need to treat the full face. You cannot allow the client to dictate what happens on that day without having this conversation with them about the positive and the negative about every procedure. So in other words, I would not allow a patient to say, I'm here for my lips. We need to talk about the rest of the face at the same time. And if that plan includes that the lips need to be rejuvenated, so be it, we can do that treatment. But if the rest of the face is falling apart and the lips are looking the best part of that face, and then you continue to inject the lip again and again and again, things will start to look out of balance. And then people start to look weird because their lips are being injected so many times and the rest of the face is falling. So it doesn't match. And so my mission really moving forward is to encourage everyone that want to practice this medicine, aesthetic medicine, is to see the face as a whole unit, one unit, and that we can address everything every time we see the clients and design a journey for them to be able to address the full face.
I remember one of the kind of the breakthrough moments in kind of my own rejuvenation timeline is that I think it was about 3 or 4, maybe 4 years ago, that I came to see you. And, I could feel like my face was changing, but I couldn't quite put my finger on it because I was just doing basic things. I was having like a little bit of Botox. I was having like a little bit of filler every now and then, but like, I don't know, it just wasn't doing the same thing. And you actually said to me, it's hormonal. You have to go and get your hormones tested. And once we know where you're at on your hormonal cycle, we'll be able to treat your whole face differently. And it really was quite phenomenal because I was completely unaware. of where I was at in my, journey. And as it transpired, and I've talked about this before, I'd already gone into menopause and had zero idea. I just put my lack of period down to a very stressful time in my life. But you said to me that if I don't catch it, I'm going to start noticing a slackening of my
much more.
jawline, that anything under here, that's all hormonal. That's, and the other thing that you're always telling me about is rapid weight loss, and your
All of
diet and
those.
nutrition.
All of those. I mean, yeah, this is going to be. I mean, it's been an eye opener for a lot of doctors as well to actually understand age appropriate treatment, because what we require at 20 is different to 30s to 40s to 50s, 70s, and on and after that as well. But it's very important to understand really what we're going through as a female or a male client. What are we going through at that time in our life that is going to affect the aging of our faces? And it's very important to understand the cause of why we are getting older, why we're losing volume, why is the skin sagging, because you need to address the cause as well as addressing what you're seeing at the same time. And I highly encourage all the doctors and nurses out there to actually investigate more before they go and just reach for the syringe and start treating without understanding what's going on.
So going back to something you just said, skin sagging, skin texture, firmness. When you do have a proper consultation, as you said, you're looking at the whole face. So in terms of trends that you think are going to be big this year and beyond, what are some of the trends that you've seen and that you're teaching internationally that you want, our viewers to be aware of and to ask for?
Well, look, skin is definitely still high up on people's list. And this year we've had the launch of Profiler, which is a bioremodeler and collagen and elastin stimulator in the skin. So, and that was probably the product I was referring to before when we ran out of product. But skin is going to be still very important for everyone. And we're looking for technologies to improve the skin health, to improve the
Skin
quality of
health.
skin health.
Yeah.
So that's very important. And to address skin health, you cannot just focus on skincare by itself. You cannot just focus on technology by itself. You're going to focus globally on the individual. You need to understand what is going on internally via hormone, emotionally. This is all can really affect your skin. So from ourselves, really, when we're happy, we're in a good relationship, our skin glow. When we're miserable, we're having it through a breakdown of a relationship, we start to get pimples and your skin feels dull and etc. So all this emotion also can affect your skin. So emotion is very important. Hormones super important. Nutrition and diet, exercise. All of those really can affect your skin. Well, when I say exercise, I'm talking about a regular form of exercise. It doesn't have to be a strenuous exercise where you're losing too much volume either, because the extreme of exercise can also make us age as well, because you're losing a lot of your facial fat pad.
Well, you've made me stop running because you said that I'd lost too much weight on my face.
You look great the way you are. I just don't want you to really lose what you have. And then, you said before you've just gone through menopause. I mean, I don't believe that you've gone through menopause, because you don't look like you really one day over 30s or something. Early 30s.
I have a really good doctor. I'll introduce you.
You might have to share his number with me one day.
Yeah.
But all those things we need to address. You cannot really focus on giving people great results without looking at them holistically and addressing all those pieces of the puzzle. Okay, they all make sense. When you just address them all together, you get the results are not 5 times better. They're more like 100 times, 1,000 times better when you address all the culprit that are causing the aging process. In the technology space as well, I think skin tightening is going to get bigger and bigger and bigger. People are really these days not looking at surgery as the first option like our parents or grandparents used to. There are many other technologies, and there's a lot of possibilities for people to actually delay or prevent surgery as long as they address holistically all the factors that are causing the skin to sag. Amongst those, and what we found really was popular in the last few years, especially at All Saints, was Morpheus 8 or microneedling with radio frequency. And why this is really sort of a jump to the top of the technologies that we use for skin tightening is because you can heat that part of the face at the smash layer directly without having to heat the skin. The needle goes through your skin, and these needles are insulated. So when you push the radio frequency button and the heat penetrates through these needles, it only gets released below the surface of your skin. So you can heat the target without risking too much heat to the skin and as a result burning the skin. So
Or
it's a very
melasma. So if
or
you had,
melasma.
yeah, because
Yes,
a lot of
because
people are reluctant to try anything that's kind of going to heat up the skin if they've got any kind of background, any predisposition to melasma. They're terrified of heating the skin.
correct, correct. And as a result, this is why more and more people are reaching for the Pico laser for rejuvenation. It's not only for treating pigmentation and melasma, but also because it's using, if you like, ultrasound wave to target the pigment in the skin, break down the pigment to very tiny particles, and so your body can clean them without really heating your skin. And so people are starting to become smarter. I found in the last few years, I think people are reading more. Maybe people are listening to more podcasts and watching more about the skin. So there's this big interest amongst the public about skin quality, product. I think I'm enjoying that, seeing that people are becoming more intelligent in that space, whilst in the past they were completely blinded to what technology is or what treatment is. I'm really enjoying that our clients are becoming more and more educated, and we can have an intelligent conversation about their journey. And it's a two-way conversation, not one way where you tell them what they have to do. We have this conversation. It's more enjoyable for me to be able to have the client participate in the journey and design the journey together.
We talked about, skin being kind of a signature to radiance and beauty and skin health in particular. A lot of the information that's coming through is about preserving the skin's integrity. And I think, if we look at early laser technology, it was very ablative. It was, you would basically burn off the top layer of the skin, peel like a snake, and then of course you would emerge with baby-like skin. But it seems to me now that the technologies that are coming out are giving a similar result, but without that rather invasive and quite traumatic wound kind of response that used to be the goal.
You're spot on, Bahar. And I think even though we still have all the ablative lasers in the clinic, we probably use them once a year, maybe twice a year. What's more popular, and then even for doctors as well as the client alike, is to actually use the less invasive lasers. One, the people don't have a lot of downtime to go and hide. I mean, I don't know where we found that downtime in the past, like 15, 20 years ago. People used to have to go and hide for 2 weeks after their laser treatment. So I don't know how we convince people to actually accept those technologies. These days, we preserve them for people that have really severe scarring or major skin issues that they need that intensity of the treatment. But nowadays, a lot of the technologies almost have no or so little downtime. You might expect 8 hours or 12 hours of redness, but none of the old side effect of major swelling, major scabbing, bleeding, etc. This doesn't happen anymore with our technology these days. It's really for the busy people. Lasers is for you and me, and then people like us that have a life and a career, and we're on the road all the time. We're on the run all the time. So we can still fit in all those treatments in our busy day and still recover and maintain a normal lifestyle and socialize.
I want to know about some of the hard to treat places and to get a read on what the trends are in terms of body. I know I've had a couple of great treatments with you. I had filler in my hand last year, which I love, and it's going to last for about normally about 3 or 4
months.
years even. But it's a hard to treat place. I use good cream. I put retinol on my hands. I add it to my hand cream. I've had laser and Pico laser on my hands before, but the filler really gave the volume and I guess reduced the appearance of my veins. But what are some of the other, you know, cool things that we can look out for other hard to treat places like under your neck,
Yeah.
elbows, knees?
So look, I mean, the principle are the same. We need to have the skin look as beautiful as possible, as healthy as possible, but you need to have enough elasticity in that skin to keep it where it's meant to be and not to sag and drop. So for instance, when you talked about your hand, you mentioned Fit technology. You've done some laser to remove some of the pigment. You've done some Pico, which is specific for that. You've probably done some BBL. You might have done some Fraxel along the way, and that actually cleaned the upper part of your skin. And with the Fraxel, you go a little bit deeper. But the
I
loss
had
of
actually
volume,
Fraxel on my knees. I haven't had it on my hands, but I've had Fraxel
right?
on my knees.
Right. But I'm just using that as an example. So you may have some of the lasers on the upper part of the skin, and that will clear your skin, will give you a healthy, glowy skin. But in some instances, we lose a lot of volume from the hand, and you start to see the bone and the ligament and the vein, and that is aging by itself. So therefore, we need to use a solution that give you volume. And then to give you volume, we need to use product that stimulate collagen, and then you get volume via that process, or you put some hyaluronic acid filler, which is an instant volumizer. And then, so this is how you address really everything that we treat in. For the neck, for instance, we can address the skin with through laser technology. We can use the Morpheus, for instance, microneedling with radio frequency to stimulate more collagen, to start to make the skin a bit firmer, and then to actually start to pull back and then lift. But also we can utilize solutions like Radius or Sculptra, where these products stimulate collagen via an injection. So we
So they're
dilute
all
these.
bioremodelers as well.
They're bioremodelers, biostimulators, really. They're a little bit deeper than the Profilo. Profilo we inject quite superficially, so it stays in the upper part of the skin, while Sculptra is subcutaneous, so is Radius. So we're stimulating collagen and elastin at different levels of the skin to really get a good win, instead of just focusing on one aspect. And so we need to go through all these layers of the skin, of a part that is of concern to us, and trying to address all those layers. Hence why it's important uh, to have a consultation about an area with your doctor, and go through your concern, and let them analyze your skin, let them analyze obviously your hormone. All of those are important, because if your hormone is plummeting on a sort of faster than you know, every day, you cannot win. So you need to fix that. You cannot really, you cannot get good results if you ignore the cause of your problems. And so it's important to actually layer up all these or treatment, and then do a journey for that part of your face or body, whatever it is.
I know that at your clinic, you have a lot of emphasis on skin treatments in between aesthetic treatments. And, you use the lasers, you do a lot of peels, you do facials. What's new in that space that you're excited about? What are some of the non-invasive treatments that you genuinely believe in?
Well, look, I mean, I'm a big fan of chemical peeling, and I've always been. And I know they're old-fashioned, but they are still really what are some of my favorite treatment, is to actually do a peel in between your lasers. And so I don't like to. I like to cause a little injury, and I like to cause an even smaller injury, and then allow the skin to recover, because we get results by allowing the skin to heal after a calculated injury. And this is what we do. It's some people just don't realize that this is what we do when we do a laser treatment. We're causing micro injuries to the cells, but it is a safe and calculated injury to help your skin to recover. I like to layer my treatment. I don't like to go strong all the way. You need to actually almost like a wave. You go high and then you go low. And so the peels are one of my favorite treatment personally, but I find that also they give good results for everyone in between. You don't want to stimulate too much injury. Pico laser has become really popular the last year, and I think it's only going to get better, because the results you can get from Pico for skin rejuvenation are beyond what we've seen in the past
And
with
can
other
you just
technologies.
explain again what the technology of Pico laser is, just for people who don't know what, it's so difficult for the layperson to
Sure.
understand what laser does
So,
what.
look, in the past, lasers we've used cause heat. So you're actually using a form of heat, whatever wavelength you use. So simply, you're creating a heat injury or thermal injury to an area. That area will, let's say we're treating pigment, the pigment will absorb all the heat and that pigment will die, and then your body will clean it away. With Pico, and why it is safe for all skin type, including dark skin type, is we're using sound wave to break down the pigmentation. So we're not really causing too much heat. And as a result, you can safely treat darker skin type, like my skin and darker than that. Well, in the past, the laser, you have to be conservative in your energy, so you can get much better results. Does that make sense?
Yes, no, it makes perfect sense. And in terms of, let's talk about darker skin types, because obviously, there's been a huge progression, and fantastically so, certainly, for me, when I was growing up in Australia, it was really hard to, there wasn't very many people who looked like me in the media. And I remember, I think when I was 9, I changed my name for a year to Angela because I desperately wanted to be Australian. And I made my parents call me Angela. I made my brother call me Angela. I still have people who remember when I decided to morph into Angela for a year. And one of the reasons for that was that even though Australia's always been really multicultural, there wasn't a lot of multicultural representation in media. And I think one of the awesome things about social media is that there are so many different faces, so many different ages, so many different styles, and you can kind of find your own tribe. And I've noticed that cosmetic companies and aesthetic companies are now really very clear and mindful that no country is a single ethnicity. And there is such a broad spectrum of skin tone and, hereditary traits that, and we'll talk about one of your masterpiece treatments, the liquid nose job, in a second, but that to me is a result of multiculturalism and this inclusivity conversation. Mm-hmm. And it must be really exciting for you as a doctor to know that companies are now really focused on having a broad range of treatment options, that in Australia, where there are so many people with darker skin tones or very fair skin tones that couldn't use the lasers or the treatments before, now there's something for them.
Well, see, time gives us knowledge. So over the years, we've learned about how to treat darker skin. So companies that have been doing development research have learned from what we've done in the past, and they can shift the technology or look for new technology that can address the darker skin. Hence why you're seeing all these new technologies. We couldn't have done it at the beginning because we did not know a safe method to treat darker skin. And whenever we tried, we caused too much injury and not much results. So therefore, was just completely left alone. But I think we're becoming smarter in the research and development zone, and then we can produce technology for everyone. And that's great, because often people with darker skin are the people that get more of the pigmentation. And then until recently, we couldn't really treat them safely or with to guarantee some results. But now I feel like we are, every year we'll have something new to address everyone in the community.
I'm going to go back to treating ethnic concerns, and one of your specialities. And whilst it's not a new trend, it's something that definitely got a lot of attention in the past couple of years, was the liquid nose job. What is it? How safe is it? And are there other parts of the face that you can treat in that sculpting way, in the same way that you've done the nose?
Sure. So look, the non-surgical rhinoplasty, or the liquid nose job, it's a procedure whereby I use dermal fillers in a very safe way to sculpt the nose and to give it a more pleasant appearance. So by that, I mean, whether or not people have got a bump, or they got a curvature in the nose, or the bottom of the part of the nose is too heavy, so it sits too low, or it's too long, many other concerns, we can treat very elegantly with very small amount of dermal filler placed in a safer part of the nose. Now, it is a dangerous part of the face. It's probably one of the most dangerous part of the face, because there's a lot of arteries and vessels and nerves that traverse that part of the face. Generally speaking, the arteries and the nerve are mostly in the center of the face, and the nose is in the center of the face. But it doesn't mean we can't treat it. And as a result, I treat maybe 6 to 8 noses a day. almost every day of the
It
week. And
is
then,
my single most favorite
yeah,
treatment ever. Like, I've had 2 nose jobs, as I've told you before. I had my first one just before I turned 18. I had a very Iranian nose. I didn't like it. I had my first nose job too early. And then I had a revision rhinoplasty when I was 25. And God knows I don't want any more rhinoplasty. But I have had a liquid nose job with you every few years. And it is such a great way to keep it
yes,
looking fresh.
it
And
is that procedure that everyone gets up and says, I need a hug.
oh, it
It's like
is
more than
just
anything else I do.
remarkable. So
People
what did you
cry.
do for my nose? You straighten out my septum. uh,
That's right. So basically, I'm playing with the light. Really, all I'm doing is shifting the light to make the light fall to the center of your nose.
The light,
That's
the
the
light.
light, because it's
Mm.
really well. That's what we do as doctors. We're using dermal fillers and Botox. We pretty much shifting the light on your face to highlight the best part of your face, and to give the illusion that is just small or short or straight or pixie or whatever it is that you want to do. So I'm placing the filler to shift the light so ever slightly to give it a better appearance, to something that we all accept, right? Because it's a visceral reaction.
It is such an amazing treatment. What can you use that same kind of principle, that sculpting principle? We talked about bioremodelers, which don't add volume. They're just a skin treatment. It's really
Correct.
for redensifying the skin and the, rejuvenation of the skin. But what are the fillers that we can use to do the sculpting work?
Now, you ask me names of fillers or types of
No, the
fillers?
types of things you can
Okay.
do.
So when this is my signature liquid facelift that I've been doing for 20 something years. It's again, we are sculpting your face to highlight the better part of your face, if you like, or really where we want the light to fall. I'm looking at your face right now, and you have a beautiful oval face. Now, to achieve a beautiful oval face, you need, if someone's lost a lot of volume and the light is falling down, you lose the light from the peak of your cheek, so the light might start to fall a little bit lower or too high, or the light will shift according to the way our faces change. And our job is to sculpt your face to shift that light. So when you're not wearing makeup and then you have a light facing your face, the light will hit on the bony show, on the prominence of your cheeks, on the upper cupid of your lips, on the chin, on the nose, along the center of your nose. So my job is to sculpt people's faces to give them those highlights without any use of makeup. All you need is the light, and
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 what
then as a
about
result.
What about areas such as, with your liquid face job? I know it's an overall treatment. And one of the best treatments I ever had was I had filler in my temple, which is
Mm.
imperceptible now, but whoa, what a difference.
It does. It does. So again, as we lose, and this is why I said to you, do not lose any more weight, because you're losing so much fat from everywhere, including your face. And because of that, I can start to see the edges of the bone. Now, when you see bone, obviously that means you're lean. But lean on the face is not perceived as lean on the body. You can be lean on your abdomen and you can see your six packs, and that is attractive for most people. But when you become lean on your face and start to see the bony edges around your face, people perceive that as an aging thing. So you start to look older. And why we do the temporal treatment is to make the transition between your forehead and then the upper part of the cheek flowy beautifully. You don't want to see any shadows. You don't want to see any bony demarcation. You want that to be a continuous arc of light all the way. So the light will come from the forehead to the cheeks, all the way to the top part of your lip, if you like, and then be just sculpted all the way to here. So almost like when you're lying on a bed and you pull your skin back, how you look. But these areas here is that continues the oval part of the oval face. So that's very important to treat the temple if you can see the edge of your bone.
I actually met a woman who was in her very early 30s last weekend. And she said to me, "How old are you?" And I said, "I'm about to turn 49. And she goes, "Oh my God, impossible, impossible. What do you do?" And I said, "I do everything. I do absolutely everything." And she said to me, she goes, "Thank you so much for being honest. Thank you for saying that, because it's actually really it's unfair when people pretend that they don't do anything. And then she disclosed to me, and she said to me, what is the favorite treatment that you've ever had? And I said, the one that I think has in this past year made me feel the most rejuvenated was filler in my temple. And then she revealed to me that she'd had filler in her temple. So, you know, she's 30, I'm nearly 50. And we both said, yes, it is a remarkably face transforming treatment to have. Now, what kind of filler is it? Is it a different, do you
We
use
use
different fillers for different parts of the face?
I tend to also for different part of the face for different people. So you cannot really use the same one for everyone. Otherwise, we'll all look the same. So normally what I look at what is it I'm trying to achieve? Am I trying to achieve some lifting, or I'm trying to achieve some padding under the surface of your skin, or I'm trying to fill some wrinkles. So I'll change the type of filler I use according to the area I'm treating, also the concern or the skin quality of that person. For the temple, and for instance, in your case, um, from memory, I think we use bilateral volume, which is a volumizer, hyaluronic acid volumizer that we use in these areas to give you a generous volume, especially at the edges where the bone meets the temporalis fossa, or where the area sinks. And from here, I'm looking at your face. I approve of it because it's the light flows. There's no line, there's no shadow there, and you want that. You want to achieve that, and this is really why we placed the filler where we placed it. But so if you can get away with the thicker filler, you always go for thicker filler because also that will give you a longer duration. Now, someone in their 80s and they have a hollow temple, I might not use the same filler because their skin is too fine and you don't want to see the filler.
Okay.
So you need to be discreet in your work. You don't want to show the filler. No one wants to see that they've had filler. You want to look better. You want the filler to do the work in the background, but not to see the filler. Seeing the filler to me is wrong. It's bad work. And so you
And
always
that
got to.
used to be the trend. I mean, there was almost a trend to look overly filled, like big lips with a big ridge, high cheekbones. There was almost like an actual trend to look
It was almost a
artificial.
status. It's almost a status. I mean, I remember those 23, 24 years ago. I get all these clients who come back and said to me, oh, everyone says I look great, but no one has said to me, I like your cheeks. And it's like, well, why do you want people to say I like your cheeks? I said, didn't they say give you a positive compliment? Yeah, but I spend money on my cheeks. I want people to say I love your cheeks. It's like, well, I says like, you know, you don't want to see the stitches on your dress, do you? You want to see the dress looking amazing. And it's the same thing with your face. You don't want to see what was done. You want to look better. And of course, all those clients were really upset back then. Now they love the fact that they look great without looking like they've had anything done. And that
Mm.
should be really everything we do in aesthetic medicine should be like this, should be seamless, should be flawless. And it should not leave a trace behind that something was done.
And the other area that I know is very popular to treat now, and definitely more people are open to it, is under eye filler. And that was kind of a controversial area. There was a lot of talk of like, if you fill the under eye, you're going to create, a problem down the track. If the filler is too heavy, it's going to stretch the skin. What are the advancements and what are the trends in that for that under eye area, for
We,
darkness, for hollowness?
Yeah, we this is a complex area. It's actually even I mean it's not as dangerous as the nose, but it's more complex than the nose because you almost need to place the filler in a particular space. And if you put this filler above that space, people get a lot of complication like swelling, like puffy, like they have the jelly bean effect above the cheek, between the eyes and the cheek. So it's a very delicate area, and as a result, a lot of people don't like to treat this area. But it's a very satisfying area to treat because when people lose a lot of volume, and let's face it, in Australia, and because we spend a lot of time on social media and on screens, people from age of 25 start to notice the dark circle around their eyes. And that is what we refer to as this dark circle because you're losing volume. And technology has changed. We have fillers specifically for the under eye, and we have these fillers. One that comes to my mind right now is Redensity 2 from Hkeik, which has brightness inside it as well. So they've actually taken an opportunity to put these brightness inside the filler. So you're not only going to get the volume, your skin quality and the color of your skin is going to be brighter. As long as you place it in the right level, and as long as you undertreat the area, because hyaluronic acid filler will swell as it integrates. So it gives you more volume. So the key is not to overcorrect on the day. In fact, it's to undercorrect on the day of the treatment and let the swelling gives you the 100% result. Don't try to actually overdo it and think, oh, that's going to last you longer. You'll end up regretting because you'll end up having these ridges under the eyes. Um, but it's a very easy area to treat if you know your anatomy. If you don't know your anatomy and don't know, you need to have that feel behind your hand about where you are, which level, which layer of your skin. And this is the trick. I think it takes experience for people to understand the different layers of your skin.
And what about the hooded eyes and crepiness around the eyes? Before we used to use, muscle relaxants to relax the look of wrinkles, but people want more than that in a
True,
non-surgical solution. What are
true.
the options there?
And again, we do a lot of dermal fillers around the whole eye. So we put filler on what we call the bony show of the eye, like looking at you right now on
Did we do
my
that on me?
I
I don't
might.
think we did. Did we?
I might, if I've done filler on the forehead, I might have done that. I sometimes I do 3 or 4 things at the same time. You'll
Yes.
only feel one injection, but it's where I
I
leave
was
the
on the
filler.
gas. I couldn't notice.
So we can do filler on the bony show, and I put it right underneath the brow with a cannula technique from the side. So we're actually safe because you go in here where there's a lot of nerve and vessels. So with the cannula, it's safe because it's blunt and you advance it very gently. So this way you're not causing any trauma. And you can put filler there. You can put filler also for people that have a sunken eyes and they start to look quite aged. You can put filler in what we call the A-frame, which is that part here.
Oh,
This
wow.
the central part of the eye. So we put some filler there to make the eye look young and rejuvenated. As well, we can put filler really also on either side of the nose. But again, this is where the danger zone of the nose. So you can be super careful and you do it with a very sort of safe camera technique. You could not use needle in there. I've seen people on social media using needle, and it really just it worries me so much because they're asking for trouble when they use a needle in these areas. It doesn't matter how experienced you are, you're asking for trouble because it's one of those days that you're going to puncture the artery and cause a problem.
And you don't want that. No,
So
that's.
cannula technique always very safe around the eyes, but it's
What
very
about
satisfying.
ears? What
I
can
do a
you
lot
do
of
around the
ears.
ears? I'm quite
I
happy with my
do
ears still, but
I do a lot of ease with fillers, and we use the same thing. I mean, we use fillers that are medium thickness, and we address the whole lobule of the ear in here, especially for ladies that be wearing heavy earring, and sometimes you lose or stretch it. So by supporting it with filler, when you wear your chunky jewelry, the chunky jewelry face the right way. It doesn't flip and turn to the back. And this is the reason, this is one of the reasons I do it, but I often do it for men because they don't like the wrinkle that develops right in the center of the lobule of the ear. So it's a common treatment. It's not treatment that people often talk about and not treatment that people notice that you've had your ears done, but it's a very popular treatment as well in our practice.
if someone was on a budget and they can't afford to have, what we've been talking about is a lot of different aesthetic procedures done over time. But it's not in everyone's budget. I mean, what we're talking about is probably a commitment of $5,000 to $10,000 a year to have all of these things done regularly. What do you think are the things that really make a difference? That if you were on a budget and you wanted to transform the way you looked and felt about yourself, what are the big things that always deliver great results and they're good value?
Look, the thing that can save you a lot of money is a good consultation. You're trying to understand what is causing the problem, what are the main problem, and what are the secondary problem. So if you panic like this and you design a plan, you save a lot of money because you will not get treatment that you don't need. And this is where I find sometimes people have come to me and they spend thousands of dollars and then they could see no results because they haven't really understood what is the issue and they're treating the wrong thing. So if you have blood pressure and I'll give you pills for diabetes, your blood pressure is going to stay the same. Nothing's going to change. Just because you're taking a pill, it doesn't mean your condition is going to get better. Same thing for the skin. So you need someone to actually diagnose you correctly and diagnose the aging process correctly in each case and design a treatment that if you spend $2,000 or $3,000, you're going to get results. And to me, this is how you save money. Not save money by doing less treatment. You save money by doing the right treatment for your face.
Mhm.
But designing a journey over 6 months to a year is also another way that you can save a lot of money. Don't do random stuff. People see things on social media and all of a sudden they just go and get a treatment and then come back and it says, oh, I've had that treatment. It cost me $3,000. Just like, well, that was not the right treatment for you. So that was $3,000 you've wasted. So I think sometimes people just get to, what's the word I'm looking for? Uh, Suggestive, perhaps. They
Yes.
see something and they go for it without
Yeah.
really understanding whether or
Oh,
not
I'm
they
like
need it.
that. Oh my God, I get so excited and I get sent press releases and invitations. And you know what? I made a decision a few years ago that I was going to just stick to being an All Saints girl because it is really tempting to get bamboozled by new treatments and
You
without that
lose the vision.
consultation process. Yes. And the same with hair, I don't uh, shop around hairdressers. I've had the same hairdresser for years and years and years. And it does tend to, and then they know, and you have the consult. Um, Dr.
Look,
Joseph, what about the neck, the most hideous area
yeah,
that like everyone kind of, we were told before that surgery was really the only
only
option.
option.
How much can you treat both the jawline and the actual neck, under the neck?
Until recently, really, I would have said exactly that. Like surgery was the only option to do for the neck. We've tried a lot of technologies, but since the invention of microneedling with radio frequency, and then since the release of Profilo, I'm finding, and of course with the bioremodelers like Sculpture or Radius, excuse me, I'm going to sneeze at um, I think combining technology for your neck is very important. Sticking to the same technology, you'll get nowhere near as good result as combining two different technologies. Yeah, one and one equal 15 when you add different technologies in my eyes. So I think combining things is very important. The way I'd go about it is to make sure you start with the biostimulator, something like Sculpture or Radius, to follow that even on the same day with some micro needling with radio frequency to tighten all the existing collagen, to stimulate the cells that make collagen to make more collagen than what the Sculpture and Radius will do. And then to make sure that you protect your neck when you go out in the sun, because you want to reduce the amount of injury that your neck skin is suffering from the sun. And it's important to look at each neck separately. In some instances, you may need to do a little bit of lifting with some threads, but that's not high up on my list, and it's not high up on our list at All Saints. We prefer to address the skin quality and then use secondary solutions like Botox, anti-wrinkles, and some fine line dermal filler, etc. But the bulk is just trying to stimulate collagen and elastin in the same area.
And what about lips? Lip fashion in aesthetics is such a funny thing. We started off like with what people used to refer to as duck lips, and then uh, various other trends came and went. But the thing that I'm hearing now is having filler to give the look of a moisturized lip, a hydrated
Yeah,
lip,
yeah.
rather than a full lip.
Which is,
What's
to be fair, this is something we've been doing for like 20 years at All Saints. I've always used the softest filler to give people that dewy, kissable lips without changing the shape. Most people that present for lip filler, they already have great lips. I think their concern is that they're worried that they're losing a little bit of that dewiness in their lips, like that hydration. So if you give them the hydration, they're happy, you're happy, and then everyone's
But
happy
do you
around.
think people think, "Oh, my lips don't look hydrated"? I think most people like look at their face and go, "Oh, my
People do
lips are
not
flat."
understand. Yes, exactly. They think that the lips are shrinking, but
Yes,
really the first issue is the hydration. So if you give them a hydrator in their lip or a very soft filler that give them that lovely hydration, they're happy without having to go much bigger in the size. Now you can increase the thickness of the filler so ever slightly to give them 5% increase in the size of the lip if they need it. I'm not saying I don't make people's lips bigger, but there's also a certain technique you can use to actually keep the lip natural by preserving the light and the shadow in the lip, because the lip is a sculptural organ on our face. It's got a lot of beautiful light and shadow everywhere you look. Doesn't matter what angle you look. The problem is When you put too much of the wrong filler or too much filler of any, even a good filler, you make them more like sausages, and they don't look like a natural lip.
We don't want sausages in the middle of
No,
our
we
lip.
don't want
No.
sausages. You know, you want a natural, beautiful lip. So you can make lips twice the size, but as long as you preserve these natural appearances of every part of the lip, you won't look like you have your lips injected. But you cannot inject a lip without addressing the surrounding area. Because if you inject the lip and you leave the surrounding area as it is, your lip looks stuck on. So you need to make sure that, and this is where I go back to the beginning of the conversation, you treat the face holistically and you treat the lips holistically. It's going to be part of your whole plan. There's no point giving someone lips that look like 20 years old when their face looks like about 80 years old. It just doesn't match.
That
So
makes
you
sense.
address the whole thing. And then when people come say, want to have my lips done, I look at the rest of the face first and I make a decision if this is the right decision or not. And we'll have that conversation. I'll explain in detail why treating your lips today is not the right thing for you, unless you want to look really obvious, which I'm not the person for that. You go somewhere else.
I know that in your practice, skincare and nutraceuticals are a big part of your business, and that part of the process of being consulted by you or the other doctors is that you do actually recommend collagen supplements, skin boosters, cosmeceutical skincare. And, you know, a lot of clinics will offer some version of that. How do you go about curating, you know, the perfect regimen for a client? What are some tips that you can give people, even if they're not with they're not an All Saints client? What are some of the things that for you are non-negotiable when it comes to looking after your skin health and radiance?
Look, as far as non-negotiable in skincare, I think science has shown us that we need some vitamin A if not done for anti-aging. You definitely need some sunscreen every single day and to reapply if you're going to be spending time outside. And you need some antioxidant to protect us against the free radicals in our environment from pollution from the sun. So they're the three components that I always say you need to have these three. If you want to live and you want to actually have good skin and you want to just get results, we need to make sure you're doing this for me in the background. Now, the supplementation, someone that is eating healthy diet, I'd probably say they don't need too much supplementation.
Mm-hmm.
You know, just keep it basic, keep it simple. As long as you're having good quality food. Now, can I guarantee that people are eating good quality food out there? It doesn't matter where you buy it from. I don't know where it comes from. I don't know how it is grown, how quickly it is grown. So therefore, I take the chance of saying, let's supplement just in case things are not really good from what we get. I mean, when we lived in the villages and you know, in the snow mountains of Lebanon, I can guarantee what everything has because I know how it was grown. I know the quality of organic produce that we really had. But these days, I don't know. I don't know. So therefore, there's always a doubt for me about the quality of what we consume. And as a result, I think it's safer to supplement than to go back because supplementation doesn't give you immediate results. It takes, you know, 6 months to a year before you can start to see some benefit from what you're taking. And it's going to be a lifelong commitment. You know, it's to do with nutrition. So I always encourage people to have some collagen supplement.
Do you
Some
believe in
super,
collagen?
look, I do believe because it's a supplement. It doesn't give you collagen. It doesn't actually go inside your stomach and then goes to your skin, give you collagen. But it gives you the backbone of what your body needs to make more collagen. So that people need to understand that you don't drink collagen, you're going to get collagen in the morning. It doesn't work like this. You're supplementing your cells with the essential ingredient to help them produce what your body needs to actually stay young and healthy. So I think it's important. It's important to take some super green. It's important to take some antioxidants. It's all going to benefit us. Now, you cannot guarantee who's going to get much better result than others, but as a safety blanket, I say if we all take small amount, not big amount, okay, the cells have got enough to deal with. It's no different to taking multivitamins. I mean, you know, not every multivitamin we take, your body's going to use, but at least it's there if your body needs some support. It's there to go. Otherwise, you're going to have a deficit and then your cells cannot function better.
Yes, no, I understand. In terms of what you're excited about, or if you had a dream about a treatment, a procedure, a device that would enter the Australian market that you've seen in your travels, is there something that we don't have that you wish we did?
To be honest, no. I think we in Australia we're at the we're up there. I mean, we know in our industry that we at the forefront of a lot of these technology. We take a long time sometimes to actually get some product and some technology in the country because of TGA process.
Which
But
I kind of appreciate that. I love that we're regulated and there is that safety mechanism. I don't think that that's a bad thing.
I agree. I agree. I like international doctors to do the research for us and give us the safety. So that suits me well. I don't like to use my client as guinea pigs, but we do have all the latest technology in Australia. There's nothing that I've come across on these conferences, except I think there've been a lot of research on cellular biology, if you like, and we understanding more and more how our cells are reacting to procedures that we have done in the past or we continue to do, and why we get the results. I think a lot of science is there to support doing things like profilo, doing the filler. What happens when you put the filler on your skin? Is it just the volume that you get, or are you getting collagen and elastin? And so now we know that the cells actually communicate because of better hydration or better environment, hydrated environment. The cells are communicating to each other better. They're working together as a team to actually work against the aging process. So we have a lot of data to support that. In the past, we've anecdotally seen some results, but we could never 100% say, oh, this is what happens. Now we know this is what is happening. So things like PRP, like FilMed, Profilo, the fillers, they're all contributing to having a better skin. So there's benefit to having these procedures.
Well, you know what? For the first time in my life, I don't have a wish list of new treatments I want to try. You know what? I haven't tried the Morpheus, so maybe I will try the Morpheus this year. That could be my venture into newness, because I have been following a very specific plan that we've had for a number of years, and I feel like I'm in pretty good shape. But this is my
You're
last
looking
year
great.
in my 40s, so this is the countdown to the big 50. So I'm going to definitely dial up the preventative.
Yeah.
As I always say, my skin is my hobby, and I slather. I would almost drink SPF 50. I don't leave the house without SPF 50, even if I'm going out in the dark. And but I think that I would, yeah, I'm curious to try the Morpheus 8 with the micro needling, because we haven't done that for me yet.
Correct. And this is really worldwide. Has been you get good results for body treatment, especially for stomachs and knees and elbows and arms.
Well, let's
And
do my knees. Let's do my knees.
let's do something unusual now.
It's always so wonderful to talk to you. I love you so much. And I know that every time we have you on the show or in the magazine or any mention of you whatsoever, people always write to me and say, but he's such a nice man.
I love you too, Baha. It's always a pleasure to be here with you and then to talk about anything.
Thank you. Here's to a very beautiful and healthy 2023.
Ciao. Thank you.